My name is Professor Shlomi Cohen.
Professor Shai Elizur.
I work in the Sheba Medical Center, in the Center for Endometriosis.
And I am the fertility consultant in the Endometriosis Center here in Sheba.
The disease is very abundant. 1 out of 10 women at reproductive age suffer from endometriosis.
So endometriosis is basically an inflammatory disease which affects women in her reproductive age mostly, and it is caused by ectopic endometrial tissue. The endometrial tissue is usually inside the uterus, in the endometrium, but sometimes we don't know exactly why. There's many theories. This tissue, the endometrial tissue, is spread outside the uterus. It could be anywhere. It could be in the pelvic peritoneum. It could be in the bladder, urinary bladder. It could be in the colon, the sigmoid, the gastrointestinal tract. It can be even in her pleura, in her lungs, even in the brain in some very, very rare cases. So it can be everywhere. And the problem is that it responds to the hormone like the real endometrium is responding.
It's actually a condition of chronic inflammation, not infection, but rather inflammation, that cannot be cured by simple modes of anti-inflammatory drugs.
So basically it's an inflammatory disease that is caused by the hormones, especially the estrogen, in the endometrial, ectopic endometrial tissue, and that's causing pain and adhesions and all the things that are involved. The most common symptoms for endometriosis are dysmenorrhea, which is pain during menstruation, and dyspareunia, which is pain during intercourse, and chronic cyclic pelvic pain. So at least for the dysmenorrhea, the pain during menstruation, it is not uncommon to find it in many, many women. So that's why it's very, very hard to diagnose endometriosis, and we still don't have a good diagnostic tools to identify it.
So many women suffer from the negligence of the system and the society, which tends to underestimate their pain and their sufferers. So it's very challenging.
So here at Sheba, we established the first multidisciplinary endometriosis center in Israel, and probably one of the first in the world. And here we give the patient, the woman, all what she needs under one place.
Also, we gather here in the center a nutritionist, because we know that nutrition is very important in endometriosis. We have a pelvic physiotherapist, and we have complementary medicine of Chinese medicine, of Chinese needles, acupuncture. We have a special treatment which is called Vigo. It's an Indian abdominal massage, and we're open to it. And we also have specialists in pain.
But if you have a high suspicion of those symptoms, please go and be checked.